I want to introduce you to my colleague and friend, George Gatto from UMKC. George, welcome to our broadcast.
Oh, thank you for having me. This is exciting.
So, George, I'm going to be honest. I've been in this field a really long time, and I didn't know anything about the USAID for the longest time because you guys are on the other side of the state. And so when I found you over there, it was like, wait a minute, hey, here we are. And since then, we've been able to collaborate on a lot of projects, and I'm so impressed with the breadth of things that you all are looking at, and the way that you really provide such a quality support to our state in terms of all the different opportunities that are available. So if you don't mind, I'd love it if you start us out today. If you want to introduce yourself and talk a little bit about you, that's great. And then when you're ready, let's dig into the IHD.
We're at the University of Missouri, Kansas City. We are the Institute for Human Development, and kind of what we call our core funding or our core program is the University Center for Excellence in Developmental Disability. I just have a few things that I'll go over here and then open it up to the questions. First of all, just our vision and mission is we are dedicated, and everything we do at the USAID is built around making sure that people with developmental disabilities in particular can live self-determined lives. We are located within an urban research university. And so as such, here in Kansas City, and then also with our partners in St. Louis, we just work really hard to promote access to opportunities and resources for all unserved or underserved populations. And as I mentioned before, the way we do this is through our partnerships, and our tagline is that we build partnerships that lead to effective social change. We do it through research, training, community development, and sharing information. So I just wanted to talk a little bit about the Institute as a whole before I talk about the USAID, or the University Center for Excellence in Developmental Disabilities. And so this graphic just shows that really, the Institute for Human Development is made up of 4 centers. One of those is the University Center for Excellence in Disability. We also have a center that focuses strictly on early childhood, and it's not just focused on developmental disabilities. It's just focused on any young people and their families who receive early childhood care or services. And we work in that program, we work across the state, and actually in every county of Missouri for that program. Then we also, I think most people, maybe our most well-known program is the Life Course Nexus. So, a lot of you may have used Charting the Life Course tools. And the Life Course Nexus originally started, it was a project within the USAID, but it's become so big, and they've kind of started doing work, in human services across the board, not just developmental disabilities. So we kind of moved them over, and they are now their own center, but still do work a lot with both individuals with developmental disabilities, with family members, but also with the service systems that work with them. And then we have this really cool project called Alianzas. It's smaller than the others, but it does have a very unique focus in that it really focuses on linguistic and cultural diversity. And that's a partnership with the University of Missouri Extension. For any of you that know that, the Extension has offices in every county of the state. And so we work really hard to make extension programs accessible to people who maybe don't speak English as their first language, or who culturally aren't really tapped into university programs. So up here, I just around this circle, well, I should say, we then have all these people that work inside of IHD who help these centers run relatively smoothly. That's just like our finance group, our HR group, and operations. But out here around all of our centers use what we call our core functions, which I'll talk about. They also employ our principles of engagement, We are all working to create self-determined lives for people with disabilities, but for anyone who's unserved or underserved. And then again, as I mentioned, the sort of the bedrock of all we do is partnerships. So partnerships for effective social change. So what is a USED? That's really what I came here to talk about. And Sharon mentioned this, and we've said it. We're University Center for Excellence in Developmental Disabilities. What you might not know is that we exist because of federal legislation or a federal act called the DD Act of 2000. When it was originally signed in 1963 by President Kennedy, it was not called the DD Act. It used the R word and just had some language that we don't use now. And you may know that President Kennedy had a sister who had a developmental disability, an intellectual disability, and really her life ended up changing so much of this country because it was through her that the president saw the needs of people with intellectual disabilities and their family members. And so he said, we need to have research and training and a connection between university and community. So we're going to create these centers. And that's what the USEDs are. At that time, they only had the funding for 19 centers, but currently we now have 67 total centers. Every state and every territory, US territory, has a USED. Some states have more than one, like for example, Texas and California and New York, which are all really large population states, have 3 USEDs within their states. So a couple have 2. Anyway, so our job really is to facilitate the flow of information or disability related information between the communities in our states and the universities. And then we work with people with disabilities, we work with family members, we work with state and local government agencies, and also with a variety of community providers. And the map here just shows you all the states and territories where there's a USED. So how do we do what we do? In that DD Act that I mentioned, they gave us 4 core functions, and those functions are: 1, we have to provide community service. And so if any of you have participated in a training that we have provided, one of our staff has provided, and you may not even know that they work for the USED, but if you've heard of the Missouri Family to Family, that's one of our programs that does a lot of training. As I mentioned, the Life Course Nexus, they still do a lot of training related to our USED activities. So we have so many different types of training and technical assistance that we provide around the state. In fact, for us, that's about the largest thing we do. We also, though, do conduct an awful lot of applied research and also a lot of evaluation. And that's one of the core functions that we are required to do. We are also then required to train people who are going to become service providers or support coordinators or in some way work in the field. And so we have one of our kind of main program in that area of interdisciplinary education is we have a master's program. It's a disability interdisciplinary leadership and disability studies program. We also work very closely with some of our partners within the system. By system, I mean the University of Missouri system, which includes UMKC, Mizzou, UMSL over in St. Louis, and then also Missouri Science and Technology University down in Rolla. Anyway, one of the programs we partner with the Thompson Center over at Mizzou to have a program called the Leadership Education and Neurodevelopmental Disabilities Program. And we also then we work closely, although it's not our program, we work closely in a variety of ways with the Succeed program at UMSL, which is an awesome program. And both Sharon and I are on their advisory board, so I get to see her at those meetings. Then our last core function is disseminate information. So we try to make everything we do accessible in a variety of formats and for all different stakeholders, from people with disabilities to family members to professionals. We do all kinds of things. And so those are our 4 core functions. Everything we do is guided by those, and we have to every year. In fact, I was just working on our annual report earlier today and making sure that we are letting our funders at the Administration for Community Living, letting them know all the stuff we're doing according to these within each of these core functions. The last thing I'll just mention real quick, and then I'll be done, is we have the DD Act, which I mentioned in the previous slide, and I'll just go back there. So this DD Act of 2000, the cool thing about that act is it also legislated into existence the DD councils, developmental disability councils in every state, and it legislated into existence the protection and advocacy within each state. So we have a Missouri Protection and Advocacy, and we have the Missouri Developmental Disability Council. And the DD Act says those 3 groups have to work together to advance, programs within their state. And so we each have our own area of expertise or area of focus as dictated by the DD Act, but we are required to work together, and we try really hard to do so. So that is a real quick run through. I could talk about our different programs. We have programs that go from early childhood to aging. So I will, I guess, stop now and answer any questions.
I would like to talk about the different program areas. It was really interesting to me when you invited me to join that one group about health equity and public health. So yeah, I'm curious about how you pick your priority areas, and maybe even tell a success story about where you were able to make some cool stuff happen.
So we have a few different programs. So as I mentioned, we have starting with early childhood programs, running through aging programs. We have programs directly related to school age children and transition age youth and adults. So one of the things that we do, and this is a project, it's on my mind because I was just thinking about it a little bit ago, is that we work with the brain injury unit at the Department of Health and Senior Services, and also with the Missouri BIA, Missouri Brain Injury Agency, which I believe is based out of Greater St. Louis. We work very closely with them. And just one of the things that we do every year with them is we conduct one of our researchers, and she's one of our leaders. Her name is Kelly Barton, Dr. Kelly Barton. She does an annual survey, a statewide survey, to find out what are the needs of children and youth in particular who have had a brain injury due to a car accident or some kind of a fall, a bicycle accident, any number of things. Anyone with a brain injury before the age of 21 is considered to have a developmental disability. So she works with people all over the state, and as a result, is able to work directly with the Department of Health and Senior Services to help them make changes within their system. And so one of the things that this led to was an actual Medicaid waiver focused on brain injury, which, as of a few years ago wasn't available, but it is now, largely because of this work that Kelly and her team have done. And they were so successful with that we now have other states coming to her and coming to our USED to say, hey, can you help us do that and help us use that annual needs assessment, so that we might be able to do similar sorts of things. That's like one example. One of the best things that I ever was involved with was several years ago. We had a grant that allowed us to do training around the state. And some of you may know Kyla Mundwiller, who actually now works for the Institute for Human Development. At that time, she worked for the Department of Mental Health. And she and I went around and we met, we were meeting with self-advocates around the state, trying to figure out what they might need or like. And ultimately, after a lot of meetings, we discovered that, this program called Project STIR. And so the people who created that project came into Missouri. We were able to hold a big training conference over in Warrensburg at Central Missouri University, and everyone came over. We spent the night. This is a program that is, the trainers are people with developmental disabilities, and it's all about helping people increase their levels of self-determination, but also understand what their rights and responsibilities are, and how to pursue those things. Long story short, we did that. We trained, I think, about 120 trainers, so people with developmental disabilities, who then went out over the last 5 to 6 years, who've gone out, and now we have, I think, nearly 3,000 people who've participated in that particular Project STIR training. So
that is such a great story. And I really think that some of that spurred the increase in really engaged self-advocates we have now, and them stepping up to the plate and taking leadership. I think one of the things that I was hoping we would get from our presentation today is to really help our families see this kind of line between the work you do, where you are able to gather broad-based information, you're able to research and find out best practices and figure out what works and what doesn't work, and then convert that into pilot programs, which we all then get to benefit from, because you work through some of the kinks, you build those partnerships, and then it's something that can spread more widely across the state. And I think some people see research and they kind of think, wah, wah, I don't want to be involved in that. But, for me, I've been able to see the results. So I love it that you're talking about the results of that. And really the reason we thought to bring you on to this show was they were talking about the USEDS partnership in the Show Me College website that's now available for the state of Missouri. So if anybody out there is thinking about going to college, there's a great collaborative website now where you can go and learn about what are the opportunities, how can I get ready for college, what are the options for scholarships, and that was really the partnership with the USED was really critical there.
Yeah, I love that project, and that's one that I still get to participate in. So it's been great. I did not necessarily help with the Show Me College. We have some actual professionals who are doing that work, but they developed a wonderful website, and there's all kinds of great resources, and they're going to continue to add to it. So I absolutely recommend that if you want to learn just what are the possibilities and how can I even make college happen for myself or for my child, that's a great resource to go to.
So we have a question about whether all state USED offices basically do the same thing. What's alike and what's different?
Well, we all are required to address those 4 core functions that I talked about. So community service, which is training and technical assistance for us, information dissemination, research and evaluation, and then pre-service training or continuing education. So we all have to do that, but it looks very different in each state. So our USED, we are kind of a freestanding center within the university. We're not affiliated with any department or school at the university. So we get to have sort of a lifespan focus, across the lifespan focus. But there are other USEDs that are affiliated with, say, a school of special education. And so all of their work ends up really focusing on education, which is important work. It's just, a little more narrowly focused. Some, in fact, several USEDs are based in university hospitals or university med schools. And so a lot of their work then just naturally would focus on healthcare or health related issues. I know of one you said that is in a pediatric hospital, and so everything they do across the core functions is directly related to, pediatrics and or children with developmental disabilities. So it really varies, but we all have to address those four core functions.
So I do have a follow-up question to that. If you, as you think about, you guys are able to see big picture stuff, what are some of the issues that you kind of start thinking about? I wonder if we need to be dipping our toe in here and doing some research or collecting some information. Are there things on the horizon we should know about?
Boy, what a great question. I think one of the things that we're trying to figure out within our network. So one thing I'll just say is we're actually a very close network, and we have regular meetings with the other USEDs around the country. And so we work very closely with those folks. But one of the things that obviously we have really realized is how many people did not receive services or didn't have internet services or didn't have anything throughout the pandemic. And so we've really, number one, looked at, well, which populations of people with intellectual and developmental disabilities weren't getting what they needed to, number one, survive the pandemic, and number two, survive it, and then continue to thrive. And so a lot of efforts around the country are going into addressing sort of disparities that people who live sort of at the intersection of disability and something else. So like could be race and ethnicity. It could be, this week is Pride Month. And so it could be disability and gender identity. And so there's just all these different sorts of identities that where we've seen a lot of issues, and particularly around race. And so, during the pandemic, we also saw that there were some people, unfortunately, who maybe had autism and were African American and ended up having some really unfortunate encounters with law enforcement that we really are working hard to do. So that's one big area. The other then is just looking at like how do we do better in terms of emergency planning and making sure that people will still receive the services they need in order to survive and thrive throughout a similar pandemic or some other emergency. And then the third area that is really big nationally, and I'm sure this will come as no surprise, this may be the biggest issue, and that is the direct support provider crisis, the workforce crisis. There are just not enough people anymore to provide direct services to people with developmental disabilities. So people are just not getting the support they need. And as a result, they're being moved into, congregate settings or just unpleasant settings. And I have a great example. We have a employee at IHD at our USED that worked here for 21 years, needed support in the morning and the evening to get in and out of bed and, shower and just to kind of take care of all those activities of daily living, for a variety of reasons. We had family members that passed as a result of COVID, and then was not able to get the services he needed from an organization, a direct service provider, and ultimately had to go to a nursing home and is in his mid-40s living in a nursing home and can't come to work. But the person who could and would have a full-time job if he had the level of supports they need, but just literally cannot find them.
Not an unusual story, but heartbreaking every time. I'm going to squeeze in two quick questions. One was just sort of about gathering information. I'm sure this comes down to your partnerships about our Missouri DD service providers reporting common issues to you that help you focus your research. It's probably less reporting and more relational. Am I right?
You're absolutely right. So we do have a lot of partnerships with organizations at every level in the state, like SB 40 boards, for example, or direct service providers, or even the state division of developmental disabilities, that they don't report to us. we do work with them on various projects.
Great. And then let's wrap up with a little brag. The last question was, so Charting a Life Course was developed at UMKC, but it's used nationwide, or does each state have their own version of Life Course? So let's brag on Missouri.
Yeah, well, it was developed here, but the really wonderful thing about the Life Course and with that team of people is that they are working with other states to make it apply to them, or with, like, for instance, with other cultural groups. I know recently they've been working with the Lakota tribe in South Dakota to make Life Course applicable to the needs of people in who are Lakota. So that's just been really one example, but we have many more. And so yes, it was developed here with our staff and all those partners, all those stakeholders who came in for 10 years, one of whom is Sharon, and probably some of you that are out there coming in and saying, oh, I tried this one, but maybe if we made this tweak. And so we make that tweak, and then it just has developed like that. It's been a wonderful, wonderful program. I just love that program, the way it's developed sort of from the community up. It's just been awesome.
I think you guys really live your mission about creating that kind of learning space where you can continuously improve, and it shows in the quality of the work. I've just been so impressed with all the projects I've been involved in. Before we say goodbye, I want to let everybody know that if you want to just go browsing around the website to see the individual projects, the site is ihd.umkc.edu. And I'm going to ask George before we part, just if there's anything I didn't ask you that you really want to talk about. Here's your time to just talk about anything that we haven't covered.
Well, one of the things that I'm personally very excited about that's fairly new is we have a podcast, and it's called Accessible. I'm going to show you on my water bottle. Accessible. The tagline for that podcast is making leaders in the disability field and their ideas accessible to all stakeholders. So we have so many cool people, from leaders, self-advocate leaders, to people just who work in the field and do all kinds of stuff. So anyway, it's just a fun thing, and I would love it if people would go and just find one that you would like to listen to. One of the best ones this year was with a woman named Susie Parker, who a lot of you might know from St. Louis. She's awesome.
I haven't let Susie on this show because I know that she would become the host and I wouldn't get to do it anymore.
Yeah, exactly. She did great on that podcast. I mean, it was really amazing. So, but anyway, there are others that are super interesting as well. So.
Cool. All right, everybody. Accessible. Go out and find it where you get all your podcasts, as they say, all the cool kids say. George, always a great time to talk to you. I'm so glad you were able to join us today, and have a great rest of your week. Thanks again, George.
Yeah, thank you. Bye-bye.